Welcome to TBRI Module 3. Connecting Principles, Mindful Awareness. As a reminder, here are our group agreements. We will stick together, there will be no hurts, and we will have fun. In this module, we will learn what is attachment patterns. We'll learn about our own history and mindful awareness. What is attachment? The attachment system and exploratory system are interrelated. Secure attachment patterns provide a secure base that allow infants to confidently explore their environment. This secure base supports their development by enabling them to learn and engage with the world, knowing they can return to their caregiver for comfort and safety if needed. We are all capable of adapting and developing healthier strategies and attachment patterns at any point in life through responsive and supportive relationships. Understanding our own attachment patterns and their origins can help us improve how we care for others. In this module, we will briefly introduce concepts related to the attachment as they connect to the principles of TBRI. This overview is not intended to provide in-depth training or expertise in attachment theory. If you are seeking a more comprehensive knowledge in this area, we encourage you to explore additional resources.
Young children use their attachment figure as a secure base for exploring and coming to understand the world. When they feel safe, they will venture out and explore the physical world and explore the social world. That sense of felt safety is a crucial aspect to feel good about moving out into the world. So building attachment is a matter of building connection, and that programming makes us resilient, sensitive to other people's needs, sensitive to our own needs, and a healthy, well-functioning human being. In secure individuals, we see that rich set of connections. When we talk about attachment, we're talking about the dance between a parent and a child. How well we're able to dance together will determine how well they're able to dance with other people later in life. We also know that my ability to dance with my child is determined by my past to a large extent. But we know that infants who become securely attached have parents sensitive to their needs. But here's the key thing. If they're separated, secure babies look distressed, but the avoidant babies did not look distressed. So they learn to mask this internal state of fear and anxiety, and that's the origins of the avoidant adult's experience. A person may do fine in situations that don't demand interpersonal connection, but when they demand that interpersonal connection, they begin to flounder. An ambivalent baby looks like a secure baby. They can be hard to distinguish. Both babies are distressed when the attachment figure leaves. The difference is what happens once they actually reunite. An anxious ambivalent baby, they want to be reunited, but once they're picked up, they may push away a little bit, or they may be stiff, or they may kick their feet. We know from research that parents of anxious ambivalent infants have only been available inconsistently. There's a fourth classification, and that's called disorganized. A disorganized baby has no clear pattern to the way they respond. The person who should be providing them security is a source of pain and hurt, and that shows up in their behavior. When attachment is derailed, we have kids who look angry, can't regulate their emotions. In TBRI, we talk about principles. Well, the connecting principles are designed to promote the kind of relationship that leads to secure attachment. And the engagement principles especially make a difference for children who come from hard places. So it's structure and nurture. But the good news is there's the hope that comes from knowing that this can be done. And the path is awareness. The path is mindfulness.
Before we discuss attachment in more detail, we want to make it very clear that attachment is not the same thing as love. We will discuss how the way we are cared for as children impact how we care for others as adults, and how as caregivers we are doing the best we can. And just as our children develop adaptive survival behaviors, we did too. The patterns in our behavior are reflections of our own experiences. Compassion is needed as this module is explored, as some of the information may feel heavy while reflecting on upbringing and caregiving. But there is hope. Our brains are adaptive and plastic, or able to change. Early in life, children develop behavioral strategies that are a reflection of their caregiving environment and are organized around getting their needs met. Brain plasticity also means that even with a stressful early caregiving environment, the brain can adopt healthier strategies later through healthy relationships. Many internal and external factors can influence an infant's pattern of behavior in the context of attachment. For instance, infants may struggle to be soothed due to physiological issues, while caregivers may face challenges such as overwork, mental health struggles, or illness, making consistent care difficult. There are many reasons why a caregiver may have been unable to provide consistent, responsive care, or an infant may have struggled with receiving care. Attachment patterns, including our own, can change with strategies and resources. We use current strategies until we gain new ones, and TBRI helps disrupt those patterns. As we move forward, we will discuss attachment patterns. The 4 categories of attachment patterns are secure, avoidant, ambivalent, and disorganized. All attachment patterns are not secure, are referred to as insecure patterns. Insecure attachment patterns occur when individuals learn early on that simply voicing their need is not an effective strategy for receiving comfort or getting their needs met. As a result, they develop alternative behaviors to navigate their caregiving environment. Attachment patterns are reflected in behavior in infancy. As we grow, these patterns become the way we relate to others and care for ourselves. We will explore how this happens and discuss broad categories of attachment patterns, their development, and how they might present across the lifespan. It is important for caregivers to understand that while attachment patterns are formed in infancy, they are patterns that permeate all relationships across the lifespan. As you talk through each of the patterns, caregivers should reflect on their own histories, patterns, and behaviors, not just those of their children. Looking at the table. Secure. History with caregiver. Caregiver responds consistently and with emotional connection. Infant strategy when upset, cry, and is soothed when the caregiver responds. Attention is toward the environment when feeling safe and toward the caregiver when distressed. Avoidance. History with a caregiver. Caregiver does not effectively respond to emotional needs. The infant's strategy when upset: does not cry or express need. Attention is often toward the environment, both when safe and distressed. Ambivalent. The caregiver responds inconsistently, especially to emotional needs. The infant's strategy when upset: it cries, but is difficult to soothe. An effort to stay in the caregiver's direct attention. Attention is often to the caregiver both when safe and distressed. Disorganized. History with caregiver. Caregiver responds in a way that is frightening, traumatic due to their own history or circumstances. Infant strategy when upset: no clear strategy, or contradictory behaviors such as being clingy and then pushing away. This table is a very brief introduction to the 4 different categories of attachment patterns we mention in this module. Attachment patterns are not just about what a caregiver does when a child is visibly upset, but this is a helpful way to show the basic differences between the patterns. As children grow, attachment patterns become more internalized and harder to see. For example, most of us don't run crying to our caregivers when we are 30, but the pattern still exists. We can still see the pattern if a 30-year-old turns to relationships or things when they are upset. All attachment patterns that are not secure are referred to as insecure attachment patterns. There are different types of insecure attachment, but what they all have in common is that those who develop them learn early on that simply expressing a need is not a successful strategy for having their needs met or being comforted by their caregiver. Instead, they adopt different behavioral patterns that help them navigate their unique caregiving environment. While insecure attachment patterns may not be optimal, they are just as adaptive as secure attachment patterns. An overarching theme regarding the difference between secure and insecure patterns is that children with insecure attachment patterns have learned that certain types of emotions are not acceptable, while children with secure attachment patterns have learned that all emotions are valid. Caregivers of insecurely attached children often unintentionally create a conflict between what the child is told and what they experience, whereas caregivers of securely attached infants tend to validate the child's experience. That conflict in children with insecure attachment patterns can be created in a variety of ways. For example, minimizing, misunderstanding, misrepresenting the child's experience. This can include things like telling a child, "You're okay, that didn't hurt," when they are in fact hurting. Not being honest about their own emotions as a caregiver. This can include things like saying, "No, I'm not mad," when you are in fact mad. And all of your nonverbal cues are indicating to the child that you're mad. Through repetitions of these type of experience, children with insecure attachment patterns have learned that certain emotions are not acceptable, or their interpretation of their internal experience is incorrect. Alternatively, caregivers of children with secure attachment patterns validate the full range of their children's emotions and are honest about their own. Children learn that their feelings and internal experiences are understood by others and can be trusted. They learn that their story is coherent, even when it is imperfected. Other examples include children whose caregivers say, "I'm so sorry you got hurt," and offers comfort, validating the truth that the child's internal distress. The caregiver who says, "You're right, I am mad right now," shows the child that they can trust their own interpretation of nonverbal cues of others, and that it is okay to feel angry. The caregiver and child in this example are attuned and in sync. Again, this doesn't mean that the relationship or experiences are perfect. It means that the child can walk away from an interaction with a coherent, shared understanding rather than an internal conflict that they must adapt to or resolve on their own. Secure attachments. Children with secure attachment experience consistent, warm, and responsive caregiving. This consistent care helps them trust that their needs will be met. It fosters self-regulation and allows them to confidently explore their environment. To help see the differences in attachment patterns, we will show you videos from a research study designed to assess the attachment patterns of infants with their primary caregivers. The research protocol was conducted with infants who are 12 to 18 months old, and it is called Strange Situation. The protocol is set up to put the child in an unusual situation to create distress, and then see how the infant interacts with their caregiver in times of stress. While caregivers are capable of acting differently because they know they are being observed in the study, babies cannot lie. The researchers use the infant's reactions and responses, not the caregivers, to learn about the patterns the infant has internalized. These videos are only short clips from the protocol, but to summarize, 3 people are involved: the infant, their caregiver, and a stranger who is a part of the research team. In the clips that you'll see, the researchers create a stressful situation by having the caregiver leave the infant in the room alone. When the stranger comes into the room to try to provide comfort to the infant, then the caregiver comes back into the room. During these clips, observe the baby's or the infant's behavior when they are alone, their behavior with the stranger, and their behavior with their caregiver. Let's watch.
Bye, baby. Bye, sugar. Sugar. Hi. How are you? You okay? Were you having fun? What are you doing with all your toys? Were you playing nice with your toys? Huh? Look at all your builders. Look at all your builders. Huh? Can you stack some up for Mama? Can you stack them up? Yeah, you're playing so nice.
What did you notice about the infant's behavior and or the caregiver's behavior? Jot some of your notations down and we'll discuss at a later time. What do these behaviors tell us about the infant's attachment patterns? Infants and young children freely explore their environment. Seek out caregiver when distressed. Easily soothed by caregiver's presence. Expresses both positive and negative emotions with caregivers. Youth and young adults understand the intention of their peers. They are open and flexible in emotional expression and thinking, sensitive to others' needs, adaptable, healthy connections to others. Adults rely on relationships with others to meet their needs. Authentic, what is going on inside feelings, matches what others see on the outside behaviors. In the diagram, we'll also see secure attachment continuum. Moves along this continuum easily, organically, often, and balanced. Feels safe on both sides. The strange situation video shows what secure attachment patterns look like in an infant. But what does it look like as the infant grows up? Secure attachment patterns can also be called earned secure or free autonomous in research on adult attachment patterns. Earned secure refers to individuals who had insecure attachment patterns as children, but were able to develop a secure pattern with intentional effort through the experience of healthy, secure relationships. For example, secure adults are comfortable seeking and receiving care because they are comfortable sharing their needs and their desires to be cared for. In healthy relationships, they see others as supportive and helpful, and they see themselves as worthy of care. Secure adults are comfortable giving care because they are able to be physically and emotionally available to those they are in a healthy relationship with. They can recognize the needs of others, and they don't shy away from or minimize difficult emotions. Secure adults are comfortable negotiating their needs because they are aware of and honest about their own needs. They can tolerate the discomfort of expressing a need, even if there is a possibility that the need will not fully be met. In a healthy relationship, they can trust that the relationship can withstand temporary stress that comes with not being in sync or negotiating conflicting needs. Secure adults embrace autonomy through authentic experience and exploration. They understand that healthy relationships accommodate differences without threatening the loss of the relationship. As we move on to discuss avoidant attachment, caregivers of avoidant infants tend to focus on instrumental care while struggling with emotional responsiveness, leading children to minimize their emotions to maintain caregiver proximity and seek distraction from the environment. Infants with avoidant attachment patterns develop into adults who prioritize independence and are skilled at providing instrumental care, but struggle with nurturing care and negotiating emotional needs. Children whose caregivers consistently meet physical or instrumental needs but are not able to consistently or effectively respond to their emotional needs learn that suppressing their emotions or distracting themselves is a more reliable coping strategy than seeking comfort from their caregiver. Caregivers of infants with avoidant attachment patterns have a tendency to focus on things and activities and can struggle with deep emotional care. These caregivers may have a hard time acknowledging big feelings without immediately jumping to problem solving. They want the infant or child to return to a state of calm as quickly as possible, but often do this by offering a toy or a distraction rather than emotional comfort. When the child is older, you might find these caregivers saying things like, "Go to your room until you've calmed down," rather than sitting with the child as they navigate a difficult emotion. This type of caregiving is not indicative of a bad or careless caregiver, simply a caregiver without the tools for warm, emotionally connected responsiveness. Perhaps the caregiver is very reserved and independent or struggles to navigate their own big emotions. It is likely that this caregiver, who was not responded to warmly as a child and now does not respond warmly to their own child. Infants with an avoidant attachment pattern often learn to turn their attention to toys or objects for comfort or distraction. If a caregiver does not respond to an emotional need, but they do meet instrumental needs, and they do eagerly and genuinely engage with the infant when the infant is smiling, playful, and easygoing, the infant learns that the best way to keep their caregiver close is to hide their emotional needs. Their brains adapt to patterns of behavior that are most likely to keep the caregiver close because proximity is critical for survival. Because of these patterns, infants with avoidant attachment patterns become older children and adults who value independence and are great at giving instrumental care. They tend to struggle with giving nurturing care and receiving any type of care because they have not learned to rely on others to get their needs met. They will likely be able to negotiate physical or instrumental needs, often by having a lot of boundaries, but have a harder time negotiating their emotional needs because they dismiss or suppress these needs. Think about the attachment and exploratory systems we talked about a few minutes ago. With avoidant attachment patterns, infants try to suppress or minimize activation of the attachment system. They don't signal their distress to their caregiver in the same way an infant with a secure attachment pattern does, because they have learned that the best way to keep their caregiver close is to avoid appearing upset. To mask their distress, they might distract themselves with toys or other things in the environment or attempt self-soothing behaviors. This means that if we think about the attachment and exploratory systems as being on a continuum, infants with avoidant attachment patterns tend to spend most of their time on the exploratory side of the continuum. They don't feel confident or comfortable navigating the full scope of this continuum in the same secure way infants do.
Bye-bye, baby. Bye-bye.
What did you notice about the infant's behavior or the caregiver's behavior? Jot down your expressions. Given what you know about the attachment system, what might be going on biologically with the avoidant infant when his mother leaves? You may have noticed the infant did not cry or seem upset when the caregiver left the room. The infant played with the toys alone with the stranger. The infant did not go to the mother when she returned to the room. The infant seemed happy and more animated when the mother came back. Despite this infant's outward appearance of looking calm, what we know based on what we've learned about attachment, development, and regulation, and what research tells us, is that this infant stress response system is activated. They have just learned to mask it. Research on the stress response system in secure versus insecure infants shows that infants with insecure attachment patterns actually show heightened stress response reactivity in the strange situation. This means that even though the infant with avoidant attachment patterns look calmer than the infant in the secure attachment video, internally, the avoidant infant is actually experiencing the same stress, if not higher. Avoidant attachment patterns. The strange situation video shows what avoidant attachment patterns look like in an infant. But what does this look like as that infant grows up? The avoidant attachment patterns are also referred to as dismissive attachment patterns in adults. For example, adults with dismissive attachment patterns will likely struggle with seeking and receiving care. They are so skilled at suppressing difficult emotion that they might not even know what they need to feel cared for. Their caregiving history also overemphasized and rewarded independence. As adults, this means that avoidant or dismissive people are almost compulsively self-reliant and are determined to handle their distress alone. They often withdraw from relationships in times of stress rather than turn to the relationship for comfort. Adults with dismissive attachment patterns are typically good at giving instrumental care. Being dismissive does not mean a person is not loving or doesn't desire to care for others. These adults likely received a lot of instrumental care from their own caregivers and therefore find it easy to engage in this type of care. Nurturing care is harder for adults with dismissive attachment patterns because they have learned to suppress and minimize their own emotions and are therefore not as equipped to effectively support others experiencing those emotions. Additionally, they may prioritize their own desire for independence over another's desire for closeness. Adults with dismissive attachment patterns are typically good at negotiating their needs, especially instrumental needs. Their caregiving history has resulted in hyper-independence. Their resistance to being dependent on others means they are typically comfortable setting boundaries in order to maintain their independence. Again, negotiating their emotional needs is harder because they suppress these needs in themselves and therefore don't express them to others. Adults with dismissive attachment patterns are very comfortable with autonomy and will often engage in behaviors that protect their own autonomy. For example, they may withdraw or create distance in a relationship when they feel their independence is threatened. They have a strong sense of self and typically pride themselves on their ability to be independent. Ambivalent attachment. Children whose caregivers are inconsistent in their responsiveness to both physical and emotional needs often use this strategy of remaining distressed to keep the caregiver close. Caregivers of infants with an ambivalent attachment pattern may have warm and nurturing responses at times and more distant or dismissive responses at other times. Rather than the caregiver monitoring the child's cues, the child is monitoring the caregiver's ability. Again, this type of caregiving does not indicate carelessness, but likely a caregiver without the tools for reliable responsiveness. Perhaps the caregiver is exhausted on the days when they are responsible for caring for an aging parent, or perhaps the caregiver is addicted to alcohol or substance and is responsive when sober, but not while using. It is likely that the caregiver also received inconsistent care when they were a child and is now providing that same type of care. Infants with an ambivalent attachment pattern often learn that the best chance of keeping their caregiver close is to keep their caregiver's attention. They become difficult to soothe, clingy, and hesitant to explore the environment. They worry that they will lose connection if they are too calm. These infants become older children and adults who are very aware of the emotional cues in an interaction or environment. They learned to read their caregiver's cues to predict whether or not they would get a warm, nurturing response or a dismissive one. These adults easily recognize when others are expressing emotional needs and want to help. At times, this can come across as an intrusive or overwhelming to others who do not ask for their help. Because these adults are anxious about losing connection with others, they could appear more dependent on others, and it is sometimes difficult for them to negotiate their feelings effectively. People with this attachment pattern tend to do well within a group setting because they can read a room. But they might have trouble with true authenticity because they are so practiced at adapting to the people around them in an attempt to stay connected. Again, think about the attachment and the exploratory systems with ambivalent attachment patterns. Children are more hesitant to explore their environment because their strategy to keep the caregiver close is to keep their attachment system activated. And as we learned, if a child's attachment system is activated, their exploratory system is not. Let's watch an ambivalent attachment in this infant. Let's discuss. What did you notice about the infant's behavior and or the caregiver's behavior? Did you notice the infant responded similarly to the secure infant when the caregiver left the room? Did you notice that the infant didn't go towards the mother until she used the "come here" hand motion? The infant was not soothed when the caregiver entered the room. The infant stiffened her back and put her hand on her mother's shoulder to indicate distance when the mother picked her up. The infant also became upset when the mother tried to set her down. Do you see characteristics from the other attachment patterns shown in this video? If so, what are they? As we look further at the ambivalent attachment, the strange situation video showed what ambivalent attachment patterns look like in an infant. But what does that look like as the infant grows up? Ambivalent attachment patterns in infants are also referred to as preoccupied or entangled attachment patterns in adults. For example, adults with ambivalent preoccupied attachment patterns are typically good at seeking and receiving care. They ask for what they need and are open to the interdependence that comes with healthy relationships. However, they can become overly dependent on others to meet their needs or to help regulate. Adults with ambivalent preoccupied attachment patterns are typically comfortable giving care. However, they may struggle with giving appropriate care, meaning that they might jump in to provide care that wasn't needed, or they might find it difficult to give authentic care in a situation where their own needs or attitudes are conflicting with the person they are trying to care for. Adults with ambivalent or preoccupied attachment patterns are usually more aware of their own needs and are comfortable expressing these to others, which equips them to negotiate their needs. However, they may exaggerate needs or concerns in a relationship to keep the attachment system activated. For some adults with this pattern, they will avoid negotiating their own needs to merge or adopt the same opinions in an attempt to feel close. Others might struggle to negotiate because oftentimes true negotiation requires compromise. Sometimes a compromise can feel like a no, and the negative feelings associated with that might be difficult for them to overcome. Adults with ambivalent, preoccupied attachment patterns tend to struggle with autonomy. This is in part because of the hyperactivation of their attachment systems, which means that their exploratory system is not activated often. The exploratory system is largely responsible for the development of autonomy. We have to authentically engage with and learn from our environment to understand who we are in relation to it. Additionally, because of the desire for closeness, adults with ambivalent preoccupied attachment patterns can struggle to be confident that individual differences in relationship do not inherently create distance or separation. Organized versus disorganized patterns. The patterns discussed up to this point are all organized attachment patterns. Although secure attachment patterns are associated with the best outcomes, the patterns we've discussed so far are organized and mostly effective strategies that help people get their needs met. The child has adapted to their environment and their caregiver. We call these organized patterns because there is a clear and predictable pattern of behavior. However, Sometimes children with histories of toxic stress or trauma might not have a predictable pattern for getting their needs met, or in times of stress, their pattern seems to dissolve. Instead, they might have confusing and disorganized strategies or behaviors. Infants are wired to seek comfort from caregivers, but also wired for survival and overcoming distress. When caregivers are a source of comfort, but also a source of distress, this internal conflict shows itself as disorganized. For children, youth, and adults with disorganized attachment behaviors, giving care, receiving care, negotiating needs, and autonomy are all challenging because they have had interpersonal experiences that are contradictory, confusing, or frightening on some level. They do not know or have not been taught how to successfully connect and get their needs met in healthy ways. And they are not sure whether people are safe or not. They also struggle with believing their own worth and value, that they can trust others, and that they have a voice because, again, their history in relationships is confusing. When children experience toxic stress, and specifically relational trauma early in life, they are more likely to display disorganized strategies focused on survival and protecting themselves from stress or harm. We won't be showing an example of a strange situation with disorganized behaviors, but behaviors you might see from an infant with disorganized strategies include a freeze response, apprehension specifically when approaching the caregiver, contradictory behavior, walking backwards towards the caregiver, closing eyes while walking towards the caregiver, repetitive movements with no clear goal or direction. Disorganized attachment patterns in children can seem disconcerting, frustrating, and scary for caregivers. Fortunately, the principles and strategies of TBRI can help children learn new, healthier patterns. Let's dive deeper into disorganized attachment patterns. Here are some examples. Adults with disorganized attachment patterns may struggle with receiving care because they want to be cared for. They might also be afraid to let people in. Being cared for can feel vulnerable, and for people with histories of distress in relationships, it might feel safer to avoid this kind of interaction. Remember that people with this attachment pattern tend to view relationships as unpredictable, confusing, or even frightening. Some adults may also struggle with receiving care because of internal struggles with self-worth. Adults with disorganized attachment patterns may struggle with giving care for similar reasons to those mentioned above. Additionally, they might not have a healthier model for giving appropriate, genuine care to others in a relationship. Again, this is not because of the lack of desire for connection. All humans are wired for connection. These adults just might not have much practice in authentically engaging in healthy relationships. Adults with disorganized attachment patterns may struggle to negotiate their needs due to a lack of practice or modeling of effective relationship skills. Additionally, someone with an unpredictable or frightening caregiving history likely spent much time in a heightened stress response. Negotiation skills such as identifying needs, communicating, and compromising require access to the upstairs brain, which is unavailable when stress system is active. Adults with disorganized attachment patterns may struggle with the autonomy for similar reasons mentioned previously. Developing an autonomous identity requires curiosity and exploration of the environment, which requires felt safety, something these adults may not have experienced often. Additionally, being comfortable with autonomy in relationship requires the belief that not all differences in a relationship are bad. For people with histories of unpredictable or confusing relationships, that might be difficult to believe. Although attachment patterns cannot be changed instantaneously, there is potential for growth and healing for all individuals. Caregivers must invest time and effort in the journey towards healthy relationships for themselves and the children in their care. It is never too late. Through healthy relationships, healing can happen for our brains, bodies, behaviors, beliefs, and biology. Caregivers help build healthy relationships for themselves and the children they care for. Healing can happen at any age. Having insecure or disorganized attachment doesn't mean something is wrong with the person. What once felt like a survival strategy may have been exactly that, an adaptive response that protected you at that time. The human experience doesn't include perfect relationships. Learning about attachment patterns and how to build more secure patterns is a helpful tool for cultivating mindful awareness. This information empowers adults to with the knowledge that their younger selves develop these patterns as survival strategies. But as adults, we get to choose if those patterns reflect how we want to show up in our current relationship. Developing secure attachment patterns. Let's talk about how to do that. Be aware that attachment pattern information can feel heavy for caregivers, especially if they are reflecting on their own childhood care or caregiving for the first time. It is important to reassure them that change is always possible. Secure attachment patterns can be developed over time. If caregivers express concern about how to build secure attachment, acknowledge that there is no quick fix, but emphasize that progress is achievable. Encourage them to start with the 4 skills of healthy relationships. Identify which skills are challenging and find small ways to practice TBRI. As TBRI emphasizes that small inputs can lead to big changes. Encourage participants to start with manageable steps. Build confidence through small wins. Celebrate their strengths. Let's reflect on our own history. Understanding and reflecting on one's own attachment history is crucial for effective caregiving. By examining past experiences with caregivers and recognizing the patterns they bring into current relationships, caregivers can take significant steps towards building authentic, healthy connections with children. A key part of any person's TBRI journey is reflecting on their own history. This is the foundation of mindful awareness, which we will discuss next. Reflecting on events and circumstances of childhood and experiences with caregivers allows adults to better understand how those experiences impact how we care for children and engage in relationships in the present. This can be a difficult topic to discuss, and it is completely normal to experience a range of emotions from anger and skepticism to regret and grief. But taking the time to reflect can help you understand what patterns you bring to your interactions, which is a huge step towards building authentic, healthy connections. Adults who have not acknowledged or reflected on their own stressful histories may be unable to respond effectively when caring for children. In general, we tend to care for children in the same way that we were cared for as children. So if you did not develop secure attachment patterns with your own caregivers, it is unlikely that you'll care for children in a way that results in secure attachment patterns. Unless you are intentional about your own healing and shifting your own patterns, TBRI will equip you to shift these patterns of behavior. A caregiver's own attachment history strongly influences the care they give to a child. Research shows that for most people, attachment patterns at 12 months of age are patterns carried throughout life without intervention or awareness. Someone who grows up with a secure attachment pattern is able to give care that is warm, responsive, and consistent. In contrast, someone who grows up with an insecure attachment pattern may not have the same capacity for consistent responsiveness to a child because that type of care was not modeled to them. There are many pieces of our own history that can influence our relationships and the way we care for children and others we are in relationship with. This includes the parenting styles of the caregivers that we had growing up, our experience of the attachment cycle, the experiences of our relationship with other adults, siblings, friends, and peers, and our buttons. Research shows we often take on the parenting style of our parent and their parents. Our values and beliefs also influence our worldwide and how people should behave. All caregivers have subconscious expectations regarding a child's behavior and the best way to respond. Reflect on your own attachment experiences. Which attachment pattern do you see in yourself? How has it shaped your interactions with others? How might this awareness influence your approach to supporting children with similar attachment patterns? Now, let's move to mindful awareness. Mindful awareness helps caregivers become aware of themselves, others, and their environment in the moment. It supports attunement, regulation, and compassion, making it essential for effectively applying TBRI strategies. There are 3 types of awareness. Self-awareness, which is an awareness and compassionate understanding of your own needs and behaviors, including understanding the impact of trauma and toxic stress in your own life. Other awareness, an awareness and compassionate understanding of another person's needs and behaviors, including understanding the possible impact of trauma and toxic stress. And lastly, situational awareness, which is an awareness of the broader circumstances or context of a situation or interaction. For an example, historical context, external motivations like policies or rules, environmental factors like smells and sounds that might be overwhelming. There are many specific strategies and practices that can help caregivers become more mindfully aware. Anything that requires a caregiver to be present will help strengthen their capacity for mindfulness. For some people, this might be formal practices like yoga, meditation, or breath work. For others, maybe they find they are present when they are exercising, cooking, or having a deep conversation with a friend. Caregivers can also practice self-awareness by taking intentional or mindful pauses throughout the day. In these intentional pauses, caregivers should check in with their body and notice any sensations, such as tension, hunger, thirst, pain, lightness, fullness, exhaustion, restlessness. Based on these sensations, consider any unmet needs. Do you need water, food, a deep breath, a moment alone, a walk outside, a stretch. Then try to meet that need. To practice being present and aware, caregivers can ask themselves the following questions. Where is my mind right now? Is my mind in the future worrying about something that might happen or planning something that might happen? Is my mind in the past reviewing mistakes, reliving bad experiences, or thinking about how my life could have been under different circumstances? Or am I in the present, really paying attention to what I'm doing, thinking, and feeling? To build other awareness, caregivers can practice being curious about why others behave the way they do. When a child or another adult does something that you find frustrating, confusing, or disobedient, ask the question, what is the need behind this behavior? Or what does this person need? Sometimes the need behind the behavior is something deeper, like felt safety in the relationship. Other times, a person might just need a snack or rest. Being curious about others' behaviors helps you spot patterns, stay proactive, and respond effectively. To practice situational awareness, caregivers can practice taking notice of what was happening in the environment when they themselves were having a hard time or when a child was having a hard time. Caregivers can ask questions like, what else was going on around me or us during that interaction? For example, you might notice that you have less patience for challenging behaviors from a child when you are in a loud, crowded space or place. Buttons. Let's talk about buttons. An important part of becoming more self-aware is identifying your buttons. We all have buttons or triggers. Often they are unconscious responses to a belief we hold on to in our bodies and brains based on prior experiences. A certain behavior, action, or sensation may trigger a stress response, causing you to react, which is your downstairs brain, rather than to respond, which comes from your upstairs brain. When this happens, you may experience a physiological response followed by a reaction that you feel no control over. You flipped your lid. Our buttons provide insight into our history. When someone pushes those buttons, our reaction is typically about us and our history, not about their behavior. As a result, we may overreact to the situation or make false assumptions about the meaning behind that person's behavior. Reactions and misinterpretations that are rooted in our own history can negatively impact our relationships. If we don't address our own story about that button and the history that created it, we are likely to continue to react in a way that does not fit the situation when that button is pushed or you are triggered. Practicing and cultivating self-awareness will help caregivers discover and address their buttons. We can try to notice when there are changes in our body, possibly a change in our breathing, body tension, posture, voice tone. We may notice that our reaction seemed over the top or too intense following a situation. We can then step back, take a deep breath, and ask ourselves, why am I reacting so strongly to this? It may take time and effort to dig up the reason for our triggers. Once we understand the why behind our button or trigger, we can make efforts to address that story in our brain and body so that the button or trigger no longer results in reaction that can cause stress and tension in a relationship.
we talk about a lot is we all have buttons, right? And when I talk about buttons, I mean, the thing that your kid does that just sends you over the edge, right? Where you flip your lid and you're saying, this is not, like, I'm no longer the caregiver, right? But I've now lost it. And what I say about buttons is two things. The first is buttons equal power, right? And so when I'm feeling powerless in a relationship, all I have to do is push your button, and now you lose control, right? And I was the person who did that, so now I'm in power, right? And so when we have kids who are constantly pushing our buttons, the reframe on that, right, is those are kids who might feel powerless. And so how can we give them appropriate levels of power? But the second thing is just saying, right, well, that's my button, don't push it, isn't enough, right? So buttons oftentimes, I believe, are windows into our past. And so chasing the why, in my opinion, is a huge part of mindfulness. So what does that mean? What does that look like? Can you guys give some examples? I know I have plenty of my own examples, but what examples do you guys have?
My buttons is the teenage tone, the tone that I know nothing and I was born yesterday and they've got it all figured out, even though they can't find their phone, and so I think for me, there's I guess power, for lack of a better word, in empowerment in identifying your buttons, and it kind of gives you that piece of like, okay, I know that's a button, so I can guard other people from my button, and realize that that's about me, and that's about my own self-worth and my own history, and that's not actually about the words that are trying to come out of my teenager's mouth. And if I just shut him down, which I have in the past, and if I just shut him down because I'm like, you are talking to me like I'm an idiot, then I'm not actually going to hear the words coming out of his mouth. And so I have to realize that this is not about me. This is more about him. And I think too, a time when all my buttons show is when I'm hungry, and everybody knows this that works with me or knows me, and so I have to be super mindful about just keeping my blood sugar up, which is kind of a different kind of mindfulness. But if I'm hungry, then I'm all over the place, and I think it took me a while to get to that point, because I can remember when I was dating my husband and he was like, Brooks, I think you need to eat something, and I was like, well, I think you need to eat something, and I hadn't really quite come to terms with that part of me yet, and now I have. And so I think that again helps me protect other people and myself from my own buttons, sunflower seeds in the car.
As we reflect, think about your own buttons. What triggers strong reactions in you? How do you typically react when your buttons are pushed? Now, let's discuss attunement. Behavior is the language of unmet needs. Remember the attachment cycle and the survival behaviors mindset? If we can recognize that a child is using behaviors instead of their voice to express their need, we can respond more appropriately. When we see behavior as communicating a need, it helps us to take a detective's perspective. What does this child need from me? What needs are they trying to get met with this behavior? Understanding attachment regulation and development helps us more effectively connect to the children and correct their behaviors. Once a child's needs is met and their brain and body is calm and regulated, we can work to address and change their behavior. When caregivers are looking for the need behind the behavior, practicing mindful awareness and focusing on connection, they can learn to read a child's cues or signals more effectively. We will talk more about the idea of catching it low in a later module. But the general idea is that if you are aware of both the subtle and obvious signals that a child is becoming upset or dysregulated, you can meet their needs before they get to the point of a big outburst. You start to notice when they are on their way to flipping their lid and can help them regulate. This is called attunement. Attunement is the ability of the caregiver to accurately interpret a child's signals and respond effectively. Some examples of attunement include learning the differences between the infant's hungry cry versus their sleepy cry, noticing that a child's tone or breathing changes before an outburst, learning to read a child's facial expression in social situations. Are they weary or are they curious? Appropriately meeting a child's needs will encourage secure attachment patterns. Nurturing this type of connection requires mindful awareness. A caregiver can only notice a child's cues if their attention is in the present moment. Even with mindful awareness, presence, and attunement, caregivers will not meet every need expressed by a child and will not always respond appropriately. Thankful there's a concept associated with TBRI called rupture and repair. The concept will be discussed in more detail later in the training, but the idea is that even when caregivers don't appropriately meet a child's needs, a rupture, they can always go back and repair with the child. When we repair a mistake or misstep in a relationship, we deepen the connection within that relationship. To develop secure attachment patterns, children must learn and believe that on average, meaning more often than not, their caregiver is available and supportive. This does not mean that the caregiver is always available and always responds appropriately. It just means that it happens often enough for the child to develop experience-based confidence in their caregiver's ability to meet their need. Through mindfulness, caregivers are better able to make sense of their own past and understand what it means for current relationships. Attachment takes two people. It's a story that caregivers and children can write together. Thank you, and I will see you in Module 4.